aim of the Liverpool Health Commission is actually to investigate disadvantaged groups of mothers and children, or families at least, in the first 1,000 days of these children's life, with a view to casting new light onto it, to seeing what the good things are that are being done and what less good, where the neglect is. Then we'll synthesise all that evidence, bring it together and be able to influence policy making.
Women often get and children often get left out of the research agenda, or certainly there's an homogenisation of research. So it's assumed that the experiences of women and children is the same as their male counterparts. And so critically, that impacts on whether research and policy can be developed, or research can inform policy, which actually has real implications for women's and children's health.
When the university was looking for something that they could be getting their teeth into, so to speak, my idea was the first 1,000 days, simply because I think it was topical and it resonated with me, having been in all these countries where you see poverty, for instance, being really at the heart of things, and women cannot seek access for antenatal care, and their babies then don't get the optimal chance for development. And we think, oh, first 1,000 days of life, that's birth to 3 years, but in fact what the UNICEF was talking about is from conception, because that development starts right from immediately after conception, and that's when they get there. The brain starts to develop particularly, so they need all the care they can get.
I think improving women's and children's health will have a lifelong impact in terms of not only their physical health, but also in terms of their well-being throughout their life course. And obviously, I think it's very important to start at the beginning, to start that roadmap, and to have a strong evidence base to inform policy, strategy and investment in relation to the type of health initiatives, the type of health interventions that actually really have an impact. So I think it makes sense to me that you get it at the beginning, you start this process at the beginning, and ultimately also the focus and the idea and the notion that it's happening here in Liverpool City region is very, very important as well.
I think by setting up and being the driving force behind the Commission, we're aiming to help to sort of highlight, investigate and address some of those key issues, particularly in the first 1,000 days, as it's described, and ensuring that we provide some concrete recommendations and outcomes from the Commission that can help improve wellbeing outcomes for all of our communities. I think we're delighted in terms of the makeup of the Commission itself. I mean, we've got some very, very experienced, high-profile members who actually giving their time and expertise is invaluable to ensuring that we get the right outcome.
I think from our perspective at the Women's Organisation, we've been around for almost a quarter of a century now, and clearly we have been working with women that have experienced significant social and economic deprivation, and the social determinants of health and the impact of those social determinants are significant in terms of individuals, I suppose, their abilities to be able to lead a healthy lifestyle. But the relationship between poverty and ill health is stark, and we have seen that. And fundamentally, this, for us and from our point of view, we really do believe that there's a need to coalesce this idea between health and the social determinants of health. And ultimately, if you just deal with the medicalised issues, that fundamentally you're not getting to the root source of the problem. So this idea of bringing those two concepts together, I think will be very, very interesting, and also will have real and meaningful opportunities for change and an overall improvement in the health of the population, but obviously specifically around women's and children's health.
Been in some of the most deprived countries in Africa, for instance, and we're seeing lots of women dying, lots of babies dying before they're born or in the first year of life. It is absolutely horrifying. You think, fine, I'm back in Europe, it's wonderful. It's not wonderful here at all. poverty rates are rising in the UK, and that is ghastly. We're seeing, along with that, stillbirth rates rising, neonatal deaths, that's the first 30 days of life, infant deaths all rising. Now, they're tiny by comparison with Sierra Leone, say, but they're not good in comparison with the rest of the Western world. And I think we have to look and see what's going wrong, why it's going wrong. And as you know, we looked at various areas of disadvantaged groups, but poverty is the one that underpins them all.
I think following the progress of the report, what certainly we'd like to see is the report being very influential, particularly in terms of the key policymakers in this area. Key policymakers, the political leaders. I mean, I know that it does already have the support of some of the local political leaders, but I think the wider agenda for the nation is particularly important.
It's so important, or it's so critical, to actually provide a focused, determined, I suppose laser-like approach to research in relation to this agenda. I think what we have is that we have a lot of research in relation to social determinants of health, but the question is the issue of how does it impact on women, how does it impact on children, because how does it impact on black and ethnic minorities? These notions of intersectionality sometimes remain unexplored, and therefore policy can be, and strategy can be, very, very homogenised in relation to how health services are organised, how they're designed, how they're implemented, and moreover then the type of impact that they have. Obviously it's particularly useful to set it in a national context, because what we're trying to do, and certainly is very important, is to actually put this on a national stage and even an international stage in terms of providing and creating that evidence base and that pathway for not only identifying emergent themes, but also being able to target resources to address those emerging themes.
As a university, we're a community of 20,000 plus students, 2,500 staff, embedded very much within the city of Liverpool, and I think the health and wellbeing agenda for our own community is equally as important as ensuring that we improve the health and wellbeing outcomes for the wider community in which we're embedded.